that kind of thing can happen. Happens all the time.
From that vicious attack right there by a patient 3 years ago to recent assaults, violence against nurses is on the rise. It's considered a hazard of the job by the nurses who dedicate their lives to taking care of others.
But a new campaign is underway to better protect these men and women in our hospitals, clinics, and homes. Here with more details, Allison Benjamin. She is an emergency room RN and a clinical nurse specialist. Good morning to you.
Good morning.
We also want to warn our viewers that some of these images really are disturbing that we're going to show you in regards to this. In this criminal case last week that really raised the temperature on this issue. Tell us about the surgeon that was accused of choking a nurse.
Right. So last Monday, a surgeon was arrested for strangulation and assault against an OR nurse. Both were on duty, and apparently the physician was upset that the nurse gave the medication at the incorrect time. And so what he did is he came back with an elastic cord from a sweatshirt and proceeded to choke her while saying, "I should kill you for this." So obviously, this is very devastating. You can never imagine that something like this would happen in a hospital setting, and especially during work duties. And so something like that has really heightened the awareness and the temperature of what's going on, because there's been numerous acts of violence against nurses, and it's something that nurses should not have to tolerate.
Well, and we saw that, I think a lot of us started thinking about this when we saw that police officer, the police detective, get into a confrontation on video with this one here with this nurse who was saying she could not release the information about the patient to protect the patient's rights under the law. Have you seen something like this before, and are there other cases that are similar?
So unfortunately, there are numerous acts of violence in the workplace. The case that you're referring to was the nurse Wubble. She was actually trying to protect and advocate for a patient and became a victim of violence. And yes, there are other cases. There was an ER nurse who was stabbed by a patient in a Massachusetts ER, an Arkansas nurse who was pushed down a flight of stairs, another there that was bitten, kicked and hit in the head numerous times, and as well 2 nurses in Illinois who were taken hostage by a criminal, and one who was beaten and raped. So unfortunately, yes, these acts of violence are growing in numbers, or are they? Because I think what's happening now is that we're starting to speak out about them. As you mentioned before, violence seems to be a part of the job, but not necessarily. It shouldn't have to be. I think we dismiss it as violence because it's usually situational. Patients are angry, they're upset, they're hurt, or there might be a medical reason why people are acting out. So we dismiss it as violence when in fact it really is still violence.
In many cases, we're hearing that this abuse can begin as verbal.
Yes.
Tell us more about how that happens, and then can that in result turn into physical violence against the nurse? Right.
So I think a majority of violence begins verbally, and what it starts with is incivility, lack of respect, bullying, and talking down to people. And I think that this happens in the workplaces because people think that nurses are those that are less than a doctor, or perhaps there are newer nurses who maybe senior nurses think are, lower on the totem pole. So I think there's this level of respect and civility that we need to have in the workplace. It often begins with bullying and verbal and lateral violence, right? So it happens in the team. But it also does happen from patients, families, and visitors who, again, like I said, are upset, they're hurt, they're angry, and they're lashing out. And nurses, because we're there 24/7, we're there to respond and take care of them,
right.
We get the brunt of those things. And from verbal, it does escalate. I mean, I've had things thrown at me. I've been kicked, punched, spit at. I mean, and, I know it sounds very graphic, and you don't expect that to happen to a nurse, but because of the nature of what we do, and again, because of things we can't control, we happen to be in the wrong place at the right time.
And it's crazy. You're trying to help the person,
yes.
and you're suffering through all this. Yes. There's a new campaign by the American Nurses Association. Tell us about that.
Right. So the American Nurses Association, in response to the growing number of acts of violence, those that we see that make the news, and those that nurses are slowly coming forward and starting to report, we have an End Nurse campaign. And what they're asking is that the public, because we want to raise public awareness, is that they text 52866 to sign a pledge and a campaign to support a zero tolerance for workplace violence. It will begin, we're hoping to have 10,000 signatures by February 1st. We're around 7,000. But I think raising awareness to this issue and this campaign will garner support and really put the spotlight on this to end it, because there's no reason for this to be happening in the workplace.
And also to come up with some things that you can do as a nurse, where if you're dealing with a patient like that, or is there anyone you can turn to and say, I either don't want to be with this person alone, or I don't want to, be in the room with this individual when they're lashing out at me. Can nurses say that, and does anything get done?
Yes, nurses should be able to say that, and I want to empower people, and not even just nurses, visitors, family, anyone who sees this type of acts happening. Now, healthcare leaders are morally, ethically, and legally responsible for creating a culture of safety, and so there are workplace violence policies, but it needs to be more than just a policy. It needs to be practice. So, you know, there's training that needs to occur, and not just the one-time training, but mock drills. There needs to be adequate staffing, security in place, a method in which people can notify security and law enforcement when necessary. And so these are things that we really want to heighten and make sure that they're available and readily accessible, and that it actually becomes a part of practice.
Yeah. All right, Alice Benjamin is an emergency room RN and clinical nurse specialist. You can follow her on social media and check out her website, asknursealice.com. Thanks for coming in.
Thank you.
Thank you. Thank you.